Okay, so we already talked about a little bit about the congenital diverticulum. So Meckels is the diverticulum, which is a type of the congenital diverticulum. That means it's comprising of all three layers, all three coats of the intestinal wall. Now, to know about the Meckels diverticulum, you have to go back to the embryology, and we know that actually the yolk sac is connected to the lumen of the midgut, proximal midgut, and it's connected with a long narrow tube, which is called as vitalointestinal duct. Now, usually in the 8th week of gestation, what happens is like this vital intestinal duct is obliterated. But if there is some problem in the obliteration, and there is a persistence of the vital intestinal duct, then that is called a kind of a remnant of the vital intestinal duct is called as the Meckels diverticulum. So remember that it's actually the remnant of the vital intestinal duct. And what is a vital intestinal duct? Is a connection, embryological connection, a long narrow tube which is trying to connect the yolk sac with the lumen of the midgut. But by the end of the eighth week of gestation, the connection between the yolk sac and the lumen of the midgut is broken down, and there's obliteration of this vital intestinal duct. But if there's a persistence, then that can lead to the development of a Meckels diverticulum. And this most commonly present at the anti-mesenteric border of the ileum. And there is a rule of two, which is important to know about the Meckels diverticulum. That is present in 2% of the general population. Its length is 5 centimeter. That is almost 2 inches in length. And it's 60 centimeter. That is 2 feet from the ileocecal junction. Okay, so 2% of general population, 2% of prevalence, 2 feet proximal to the ileocecal valve. That is almost 60 centimeter from the ileocecal valve in adults, and it's 2 inches long. So this is a rule of two which has to be followed in case of a Meckels diverticulum. Again, it can be asymptomatic or incidental finding, or the patient can actually present to you with the signs and symptoms of acute appendicitis because its location is somehow in the right iliac fossa to the anti-mesenteric border of the ileum. So actually, its presentation can be compared with acute appendicitis. The patient can present to you with the right iliac fossa pain, vomiting, and anorexia, and you're suspecting acute appendicitis. And when you're trying to open up the patient, that there is this diverticulum present instead of the appendix seems to be perfectly normal, but there is Meckels diverticulum which is inflamed, which is the Meckels diverticulitis. So remember rule of two: 2% of general population, 2% of prevalence, 2 feet from the ileocecal junction, 2 inches long, which is almost 5 centimeter in length. So the clinical features can be asymptomatic, hemorrhage, diverticulitis, intussusception, or they can be chronic ulceration. And in case of the chronic ulcerations, the patient can present to you with the chronic abdominal pain, which is settles spontaneously on its own, or it can be aggravated by eating, and the patient can present to you with the signs of diverticulitis. There can be fever, there can be vomiting, anorexia, and tenderness in the right iliac fossa, and you can mix it with the acute appendicitis. There can be intussusception, or the patient can present to you with the hemorrhage or bleeding. So these are the clinical features. There can be intestinal obstruction, there can be perforation, all the signs which I've already described in the jejunal diverticula. These clinical manifestation can be present in case of the Meckels diverticulum. Okay, so it can be a gangrenous, if there's a perforation, and sometimes the patient can present to you with a gangrenous Meckels diverticulum, and obviously if there's perforation, the signs of localized peritonitis or signs of generalized peritonitis can be present in such cases. Okay, so talking about the management, again, imaging modality would remain the same. In case of the Meckels diverticulum, you go for technetium scan 99, you go for contrast studies, barium studies, or you go for the gold standard for the diagnosis as a CT scan. And obviously there would be thickening, and there would be free if there's a perforation of Meckels diverticulum, then the possibility that there are multiple airfoil levels, and there is a free fluid in the peritoneal cavity. Now, talking about the treatment, if there is you have to see if the patient is symptomatic or the patient is asymptomatic. So if the patient is asymptomatic and you were doing imaging modality for some other causes, and they are discovered incidentally on imaging, then there is no need for elective surgery. But if the patient is asymptomatic and it's discovered incidentally during operation, then there is some criteria which need to be followed for the resection. If the age of the patient is less than 50 years and male, is the gender of the patient is male, diverticulum length is greater than equal to 2 centimeter, and there is presence of abnormal tissue, there's a broad-based diverticulum, or there's a presence of fibrous band attached to the diverticulum, then you go for surgery. Okay, so remember this this criteria, that in case of asymptomatic patient and the diverticulum was just discovered on imaging, then you don't have to go for surgery. Okay, so but if the patient is asymptomatic and the patient was being opened up for another pathology, but there was incidental finding during the operation, then follow the criteria. If the age is less than 50 years and male sex, diverticulum length is greater than equal to 2 centimeter, there's a presence of abnormal tissue, there's a broad-based diverticulum, or there's a presence of fibrous band attached to the diverticulum, then you go for surgery. But if the age is greater than equal to 50, female sex, diverticulum length is less than 2 centimeter, and there's a narrow-based diverticulum, absence of the fibrous bands, then you can wait, and then you don't have to go for immediate surgery. In case of symptomatic Meckels diverticulum, then you have to go for surgery, and the surgery is obviously diverticulectomy. We will be discussing diverticulectomy in the next section.